much for joining every week. We go over different topics in plastic surgery and I get to answer your questions. I'm Dr. BBL and we're here in Miami in Pure Plastic Surgery. And we're wrapping up October month of baking the cake, which is the BBL procedure. So we started the month talking about the safety things that we do to minimize complications with BBL. We went over risks of BBL. We went over tips for recovery. That was a great live. They went over in detail about what things to purchase or have to ease your recovery. We went over myths or misconceptions that people usually have about this procedure. So now I'm going to compare other body contouring procedures to BBL and basically what's the difference so you can know a little bit better if you're a candidate for BBL or if you're a candidate for another type of procedure depending on what is that bothers you, okay? So when we're talking about BBL, go back to what is it? It's liposuction to the trunk, so lipo to the abdomen, flanks, back, and using that fat, transferring it to the buttock and hip area. And we call it body contouring because it truly is. It truly changes the shape of a person. There are some limitations, of course, with your foundation, your skin quality, but it is a very powerful procedure for body contouring or changing that overall shape. It is something that you can tailor somewhat to your goals. Regarding how much hip, how much volume, just shaping, and all that. But there, of course, like any other procedure, has some limitations. And that's why some patients are really candidates for other body contouring procedures. Mainly, skin elasticity and muscle weakness or diastasis are going to be the two things that we can't really target with a BBL. So let me discuss in detail what is diastasis or muscle weakness and what I mean by skin elasticity or laxity, and then I'll describe the two most common body contouring procedures. Of course, there are more variants of this, but the two more common that we can address with those two things. So basically, diastasis is the separation of the rectus abdominis muscles. So in the anatomy, we have the six-pack muscles. They go from the rib area to the pubic area, the belly button is here down the middle, and we have the six-pack muscles, right? The six-pack muscles should be close together here in the center, and that's called the linea alba. The linea alba is the line that goes in the center of our abdomen, and the two six-pack muscles are side by side. That's the anatomy. But when we have either changes in weight, you gain a lot of weight, or any increase in the abdominal contents. Fat is one of the causes of this, and the other most common is pregnancy. When we increase that space, those muscles stretch, and they don't only stretch the muscle itself, but this area here, that fascia, may stretch out. And these muscles that were very close together, we have the ribs here again, the pubic area, we have the muscles, then instead of being in the middle here, we have that separation in the center, the belly button stays there, and one muscle is here, one muscle is here. And that separation, this area here, it's called a diastasis. That separation is not a defect, it's not a hole like a hernia, so it doesn't have an increased risk of incarceration or strangulation of your abdominal contents like a hernia does, so it's not an emergency to fix, and the insurances don't cover it because it's not a problem of a strangulation and incarceration. So this is considered an aesthetic or cosmetic improvement of the abdominal wall to bring it back together. So how do you know if you have diastasis? Basically, two tests that you can check. One of those is palpating your body. After 6 months to a year of delivering your baby, your abdominal wall may have shrunk significantly, but you may still feel that you're palpating and this feels that you have substance there, muscle, and then you palpate in the middle and it feels very weak, like you can go in and out, and you can people can tell me, I feel like 2 fingers I can put in between, or 3 fingers, and that's that separation. It's not a hole, again, it's more of a weakness, okay? And the other thing is, the thing that that people sometimes get confused between is the muscle separation and visceral fat. Visceral fat is the fat that we have inside of our belly. If you have a lot of visceral fat, you may look like a pregnant belly, like with a diastasis. The difference is when you lay flat, you still have a bulge, that's visceral fat. With a diastasis, when you lay flat, the belly will flatten out. Even like concave, if you don't have a lot of visceral fat. I have patients that when they stand up, they look pregnant, but they're very, very thin. They might even be a BMI of 20, but they stand up and you see that bulging of the abdominal wall, and that's because of the diastasis. Unfortunately, lipo is not gonna fix this, okay? Why? Because lipo takes care of the fat in the subcutaneous space, okay? So if we're seeing it from the side, we have different layers. We have the skin, we have the muscle, and we have fat in this area, which is the subcutaneous fat. And deep to the muscle, we have the visceral fat with the organs and all the other abdominal contents, right? When we're doing liposuction, we're emptying this area here. So how do you know if you have more subcutaneous fat, more visceral fat, if you have a diastasis? The pinch test is called. You grab your skin and you pinch it. The thickness in between your fingers, that's the subcutaneous fat. So if you have a pregnant belly look, but you pinch it and it's really thin, then you don't have a lot of subcutaneous fat. What you have is diastasis or muscle separation. If you pinch it, but it's still like moderate, but you still have a bulge that you can't explain from the pinch, you may have a combination of both. You may have subcutaneous fat and separation. But if you're standing up and you have some bulging and you pinch it and the majority of it is the thickness is in your fingers, then you mostly have subcutaneous fat. If you mostly have subcutaneous fat, you're a perfect candidate for a BBL or liposuction. If you have little subcutaneous fat, but more bulging or the separation, then it's better to fix this before the lipo or the BBL, because you're not going to see a major difference in the waist or in the bulging of your abdomen without bringing this back together. And why do I mention the waist? So think about it like a corset. When this expands, you see the waist here is nice and tight because these muscles are in the middle. When this separates, I hear a lot of postpartum females, mommies out there that they say, after my pregnancy, I feel so boxy. I lost my shape because of this. This muscle separated, and instead of this, then you have your waist like this, more boxy. When I do the muscle repair, I bring the muscles back to the middle, and what does it do? Brings the waist in like a corset. Okay, so there is shaping with a tummy tuck, and the shaping with a tummy tuck is a combination of the muscle repair and liposuction to that waist to accentuate your waist. Okay, you don't have to have a tummy tuck and be boxy. That is all in the muscle repair and in the liposuction. Okay, so these things are going to be so important to determine if you need a tummy tuck first to get that muscle repair, cinch that waist, and you can always do a BBL later. It's better to do the body contouring, tummy tuck, or circumferential body lift first to get rid of that muscle laxity, flatten everything, tighten everything, and then we can do the BBL basically like a cherry on top. We want to get that contouring after we get rid of that muscle separation, we get that foundation in place in order to basically maximize your results for the BBL. And the other one is excess skin. Excess skin and skin elasticity, skin quality is a major contributing to your results after a BBL. I can empty all of this fat, but if the skin doesn't attach back to the muscle, you're not gonna see a major change in your body shape. Why? Because this skin is wrinkly or bulgy or starts to create irregularities. And that is because of the skin elasticity or skin laxity issue. With the tummy tuck, what do we do? Different than with a BBL. Those two things. We excise that excess skin and we repair the muscle, okay? So if you have a problem with the skin, how do you know if you have skin elasticity issues? Well, you can pinch it. When you sit down or you have a fold, or some people standing up have a fold. If that's the case, it's better to do a tummy tuck to get rid of that excess skin. And I hear it a lot. People are like, but really, I am focused on my shape. I really don't care much of that skin elasticity. I just want the shape on the butt. Well, the real advantage and result for the BBL, majority of it really is from the body contouring part on the torso, okay? If we don't get that waist cinched, if we don't remove that excess skin so it looks nice and tight, the buttock shape and waist and hips are not gonna look as dramatic as you want to, okay? So whenever I hear I just want the shape of the buttock, I don't care about the front, you will when it's wrinkly and when the abdomen is not flat, you're not gonna see that projection. Just imagine when you're looking at the side, you have a beautiful projection in your butt, but the belly looks like that. And your legs with the belly button here. It's not gonna look great as this projection with a belly that is flat, complementing that shape, okay? And a circumferential body lift. So basically a circumferential body lift is a tummy tuck, but extending it all the way to the back. Why and who's a good candidate? Majority of patients that will benefit from a circumferential body lift is massive weight loss patients. When you lose the weight, you have buttock ptosis or droopiness. And that droopiness is not gonna get fixed with fat only, okay? How do you really know? So I'm gonna show you this beautiful patient that wanted to improve her shape, and she had had 2 BBLs prior by other surgeons, and she came to me with the concern that the shape wasn't what she was expecting. She wanted to really cinch in that waist and the love handles. She didn't like them, and she wanted more fullness in the bottom. When I examined her, I really noticed that those love handles was not really fat, is the droopiness from the losing weight that really is not going to be taken care of with liposuction. We needed to excise and really lift, physically lift the buttock. So I'm going to show you, this is her before. You can see there, Willie?
Yes.
Okay.
1 second. Just repeat.
Yes.
Okay. There. Okay.
So here, this is the before, right? And this is the love handle area that she hated. This had been lipoed twice, emptying that, and really didn't see much of a difference. And she wanted more roundness in the bottom. She really didn't care much about the cellulite, but she would have liked to be improved. So a lot of this cellulite is really skin laxity. The skin was sagging here, the buttock was sagging, and all of this skin, when you pulled it up, most of that wrinkly and that irregularities were actually gone. And I recommended to do a combination of things on her. What was the surgical plan? What did we do? Did a body lift. So I extended, she had already a tummy tuck, so this was focused only in the back. Okay, I did not do a circumferential on her because she already had the tummy tuck from a prior surgery. So all of hers, or this surgery, was in the back. So extended that tummy tuck incision all the way to the back, and you can see it's an incision that is well hidden in a bikini line. Lifted her buttock, excised all of this tissue here, lifted the buttock, and then I did lipo the entire back, focusing on that shape on the waist, and use that fat to transfer it to the lower part of the buttock to achieve that upside down heart shape, okay? By removing the excess skin here, that is how we were able to achieve this definition on her waist, and then using the volume that we lose sometimes with a body lift, because a lot of this volume is excess skin sagging. So when you lift and remove that excess skin without a fat transfer, sometimes patients tell me, I feel flatter, I feel that I lost my buttock. So the combination of fat transfer with this procedure is very powerful to achieve that shape and volume. And you can see all of those cellulite dimples were really skin laxity. So those were filled in and pulled, so you have a smooth appearance of her buttocks. She is static. This was an early post-op picture. The later pictures that I have is her with a dress. So she was showing me how happy she was that she could wear a dress that shows her beautiful figure and not the love handle sticking out. Okay, so sometimes a combination of things are the most powerful and the most changing depending on what we're targeting. Okay, so focusing on the two most important things, that the BBL, which is a great surgery. I'm not saying that one is better than the other. It is all about what is it that you need and what are your goals, right? So BBL is very powerful, but it does not fix skin elasticity and muscle repair, diastasis, okay? So it depends if you have those two things. A combination of procedures would be best for you, okay? I'll take some questions now.
Okay, let's start.
Let's do it.
Do you use ultrasound on lipo or it's only during fat transfer?
Very good question, and a question that has a little bit of different answers. So the ultrasound that you're thinking about is probably the ultrasound imaging, right? What we see when I'm looking at the cannula. That part I use for the fat transfer. The risk of fat embolism, fat traveling to your lungs and causing respiratory issues and even death, is with fat transfer, is not with suctioning or liposuction, okay? So the ultrasound, we use it for fat transfer, okay? But there is another thing that is different. It's the same name because it's ultrasound, but instead of ultrasound imaging, seeing like the baby ultrasound when you're pregnant, is ultrasound energy, and that's what we call VASER, okay? So that we do with the liposuction to improve collagen formation, improve the skin recoil or skin tightening, and also decreases bleeding by coagulating the blood, and decreases bleeding, therefore decreases swelling, bruising, and recovery is faster.
How long is recovery after a lower body lift?
Good question. This is the surgery that she's asking about. Recovery, I always divide it in different in different stages. Let's say the first stage is the first week. That's the first week you're gonna be here in Miami. If you're not from Miami, you're gonna need someone with you. You can't recover from this alone. You need help. Need help in the sense of getting in and out of bed, bringing you water or fluids to stay hydrated, helping you ambulate so you have some support. That's the first week. So the first week, plan to have more help. The first 2 to 3 weeks, try to avoid working, okay? So depends on your line of work, but you're gonna have drains, you're gonna be more stiff, you're gonna be tired more easily. So if you can take off of work for 2 to 3 weeks, that's ideal. But you have to plan for 6 weeks not working out, wearing your faja in foams and boards, and also no submergent water. So don't plan any big vacation or any big event for 6 weeks.
Okay, and about 6 weeks is this question too.
Okay.
As you asked, what's the purpose of a faja after 6 weeks on a tummy tuck?
Very good question. So fajas are really important in the initial recovery period, and they are helpful for the skin. Once we empty all this fat, the skin attaching back in the muscle. In the tummy tuck surgery, we elevate all the skin so I can access your muscle. So we want that skin to attach back to the abdominal wall, and the faja gives that compression, right? To get all of that and avoid fluid buildup, avoid the skin irregularities. So the first 6 weeks is the most important at all times. After 6 weeks, why do we need to keep wearing the faja? So after 6 weeks, I tell you to decrease the faja to 12 hours a day. You're still going to be swollen and you are going to have fluctuations in swelling, but you need to start weaning off the faja, that compression. Your body's used to having that compression, but that's not natural. You're not going to live in a faja for the rest of your life. There's some people that do, but that's a personal choice. I don't ask you to live in a faja. We did the surgery so you can have a good shape without a faja. So your body needs to wean off of it and start that lymphatic drainage on its own, right? It's basically a training of your body to be out of the faja little by little, okay? After 3 months, you can stop the faja, okay? There's some people that feel more comfortable wearing the faja a little bit longer, maybe up to 6 months, but really post-surgical, it's up to 3 months.
Next question. Can you discuss about the arm banding on the arm lifts? Why they happen and can we avoid it?
Very good
She's
question.
having an arm lift very soon.
Awesome. So, very good question. What's arm banding? Is basically that the scar gets tight. So when you move your arm, it causes some tightening, especially when you're stretching. So scars, the way that the body heals is by contracting, okay? That's the natural healing process in our body. So the first 6 weeks, I'm gonna ask you to be kind of, we call it T-Rex arms, to minimize movement of the arms, to avoid wound openings. But after 2 weeks, when this process of healing starts to get more chronic, we want to avoid the scar to become so tight. So I ask you to start massaging the scar, applying silicone-based scar products that help the scar to heal, but not to overheal. And when I say overheal, is hypertrophic scarring, tightening, and all that. So when you're applying the silicone gel, you should be massaging the scar, okay? The first week, right, gentle. After you have a scar, you can be a little bit more aggressive, a little bit harder on the scar. And not only down, but you can do 2 thumbs, kind of spread the scar, okay, longitudinally, to try to prevent that scar from tightening too much. And after that first 2 to 3 weeks, you can start also stretching. Stretching is so important to, again, increase the range of motion in your arm. The arm is the most mobile extremity of our body, okay? So the range of motion of your shoulder is the most mobile joint, all over, front, back, 360. So we want that mobility back in your arm, so stretching is very, very important.
Ok, YouTube's on fire. Y la pregunta es en español.
Okay.
Sí, dicen, hola, tengo una pregunta. Después de un tummy tuck, ¿es posible sentirse que no puedo respirar bien y sentir ansiedad? Yo quiero hacerme la cirugía, pero siento miedo.
Ok, es normal sentir miedo, sentir ansiedad cuando estamos preparándonos para una cirugía. Acuérdate que todo tu cuerpo se acostumbró a tener mucho espacio, tus órganos. Ellos están bien acostumbrados a estar así separaditos. Y yo voy a poner esos músculos de vuelta al centro. Así que todos esos órganos que estaban así, bien separaditos y bien cómodos, de repente están apretaditos. Como cuando estabas embarazada, si estuviste embarazada, que hay espacio, el espacio se limita y puede ser que te sentías un poco falta de aire, especialmente cuando estabas caminando. Eso es transitorio o temporero. Cuando tu cuerpo se empieza a acostumbrar, vas a volver a tu normalidad. Esto es todo en el periodo postoperatorio inmediato. Falta de aire que no mejore con descanso no es normal, ¿verdad? Esas son cosas que tenemos que monitorear. Pero la falta de aire con el caminar, con el ejercicio luego, después, es normal y va a ir mejorando mientras tu cuerpo se va acostumbrando a que todos esos órganos estén apretaditos nuevamente.
TikTok. After a BBL, should I walk every 15 minutes to avoid blood clots for 2 weeks?
I say every hour, because if you walk every 15 minutes, you're going to be walking 100% of the day. So it's okay to rest a little bit, okay? So I say around 10 minutes every hour, okay? So you have some rest in between, and this is very, very good for avoiding blood clot, but also recovery. You want to circulate the blood, you want to move this, the lipo areas tend to get very tight. So if you don't move, you get tighter and tighter and tighter. When you move, you walk, you stretch, those things help in your recovery. And yes, for the first 2 weeks is the higher risk of blood clots, so that's why those first 2 weeks want you up and walking. Okay?
Yeah.
Awesome. Thank you so much, you guys, for joining. And we wrapped up all the BBL talk. It's not that we're not going to talk about BBL later. Of course we are. This is a surgery that I perform very commonly. And there's a lot of questions about this procedure. So we'll revisit this topic. But I like that we can organize our topics now, like on a monthly basis. So if you have any questions about BBLs, about any procedure, please drop them in the comments, drop them in DM if you want to, and I'll gladly answer you guys. The other thing I wanted to share with you is my newest accomplishment being facts. What is that? I'm a fellow. Where's the confetti?
Yeah, it's imaginary.
Imaginary confetti.
Yeah.
FACS is fellow of the American College of Surgeons, which is like the final step in the certification and training and education and everything process. So when you see a surgeon that after their name they have the MD followed by FACS or FACS, means that they've accomplished a higher level of certifications in surgery. So I'm very, very happy to finally share that with everyone. It's been a long training and education and exams and everything, but it's completely worth it to give you guys the highest level of surgical care, patient care. Get there because I'm not alone. So my family, my husband, my parents, everyone here at Pure, it was super helpful for giving me the time for the boards, for the paperwork, for everything. So a big shout out to everyone that helped me out. I'll see you guys next week. Happy Halloween. Be safe out there. And I'll see you, oh, actually not next week. Next week I'm on vacation. So, so you'll be seeing stories about my vacation. I'm super excited. I'll see you the following week on Tuesday Tips. Take care.